Discs are essentially the natural cushions between every level of your spine. Between each two bones of your spine, there's a disc. And based on your genetics to some degree, wear and tear of many types throughout your life, people experience varying degrees of degeneration of their discs. And some people are unlucky and it happens sooner than others. One form of this degeneration, although there are many others, is bulging of the disc. And essentially what's happening is the disc is bulging out into a space where the nerves are traveling, and because there's not enough room for the nerve to travel freely, it can become pinched and inflamed and cause symptoms, typically in the legs. There are a number of ways that we can relieve the pressure from a bulging disc where it impacts a passing or an exiting nerve. You can treat the herniation most often conservatively, non-surgically. When these fail, and over a certain period of time where we've established that the bulging disc is not going to improve with time, the inflammation that it's causing is not going to improve, we think about surgical remedies for that. You can do a surgery a number of different ways. When we're talking about a bulging disc, usually we're thinking about a simple surgery where we make an incision in the skin and use micro instruments or an endoscope or a tube to give us just enough room to see the area where the bulging disc is and essentially scrape it away or remove it to free up the nerve so it's not being compressed anymore. The outcome that a patient can expect after a surgery for a bulging disc is almost always a positive one. Our goal is that a patient would have essentially none of the symptoms that they suffer preoperatively, and we achieve the goal 90 or 95% of the time. So overwhelmingly, patients who have a strong indication for surgery for their bulging disc are better, and usually all the way better, after a surgery.